Saturday, the WHO declared monkeypox a global health emergency. No WHO, no new health emergencies until you finish your COVID, little mister.
Monkeypox is spreading rapidly across the United States and dozens of other countries. Cases have been detected in nearly all 50 states, soaring from 1,400 reported less than 2 weeks ago to nearly 3,500 nationwide today. At least 2 of the latest cases have been found in children. Health experts say this rarely fatal virus is marked by painful lesions and sores, which are spread throughout close physical contact. Joining us now, Director of the National Institute of Allergy and Infectious Diseases and Chief Medical Advisor to the President, Dr. Anthony Fauci. Dr. Fauci, thank you for joining us again this morning. We have a couple things to get to, but let's just start with the state of monkeypox. How concerned are you for what you're seeing as cases seem to surge across the country?
Well, certainly you always have concern when you see the surging of cases of a disease that's a virus that's not a new virus, but that's new now to the pattern that it's doing in spreading from an epidemiological standpoint. You have to note that there's about 99% of the cases are associated with men who have sex with men. So that's the group that appears to be most vulnerable. The transmission is almost certainly through close skin-to-skin contact. We have knowledge of the virus itself. We know what it is. We have vaccines. We have antiviral therapies. Now we've got to reach out to the community at risk, but also keep an open mind that, as you mentioned, recently 2 children were infected, very likely due to contact, skin-to-skin contact, with someone who had been infected. Now, what do you do about that? You try to get the interventions to the population most at risk and keep an open mind epidemiologically of where this virus is going. Is it concern now for the general population? Well, it doesn't look that way from the epidemiological pattern, since it seems to be very, very highly concentrated among men who have sex with men. And that's the population, with an open mind to everybody, that we've got to focus our efforts on outreach, on getting therapy, on getting vaccines, and on getting tested. But it's something absolutely to be taken seriously.
Well, Dr. Fauci, there have been complaints from that group that not enough has been done. What is the reason behind, in their estimation, the slow surge of vaccines to those impacted by this, as well as the lack of a declaration of an emergency from the White House?
Well, let's just take one of those questions at a time. I mean, obviously, when you have a situation that's evolving, you would have want everything in place right there. The initial response had been in what's called a post-exposure prophylaxis, to get vaccines to people who are at risk because there's a known contact with someone who is infected. That now, since we're seeing cases that are community spread, has now evolved appropriately to have a balance, not only for post-exposure prophylaxis, but to get people at risk and to vaccinate them in a pre-exposure prophylaxis. Now, obviously, out of necessity, that's going to require a lot more vaccines. So right now, there have been about 323,000 doses of vaccines that have been distributed. Hopefully, and I believe it will happen, by the end of the month and maybe within the next few days, there'll be another 800,000 doses of vaccines so that you can now broaden the net of protection with a proper balance of cases, namely giving it to locations that have a high number of cases, such as New York, Los Angeles, and other cities, but also give it to people and have it in place in locations where just by the population demography, there are people at high risk. So that's the shifting in the approach towards vaccine distribution. But you always got to look at a situation like this and say, we've got to do better than we've done, because it's a serious problem. And we're going to be doing that. And I think that the 800,000 doses of vaccine that will be coming shortly will solve some of the issues that I think are being a concern among the community.
Dr. Fauci, as we see the vaccines being brought in, as you say, shortly, will we also see an aggressive campaign to get people vaccinated and get people understanding what we're facing here? One of the things that you were effective in doing as we saw the pandemic spread is you worked with getting the message out. Conference of National Black Churches and others that you were there on the ground, went to Harlem with Choose Healthy Life. Are we going to see an aggressive campaign of awareness that will drive people to using the vaccines, particularly where the demographics say that there are a higher percentage of people that may be the susceptible people to get this virus?
Reverend, you got that right. Hit the nail on the head. There are 4 pillars to this. There's testing, there's treatment, there's vaccination, and there's outreach to the community. We've got to outreach to the community, predominantly at risk, men who have sex with men. But when we do that the way you and I did back in the day of HIV, Reverend, we've got to do it without any stigma associated with that. Right. Because when you have stigma, that's the biggest enemy of public health. So I agree with you 100%. Outreach to the community is going to be a very important part of this effort.
Dr. Fauci, as you've explained, monkeypox is primarily spreading among men who have sex with other men. However, the 2 outlier cases, the 2 pediatric cases, what can you tell us about how that transmission happened and what parents can do to protect their children?
Well, it was very likely that a person, and this is being epidemiologically investigated by the CDC, that a person got infected because that person very likely had sex with a bisexual man, got infected, and then in the normal interaction between a mother and a child, you have close skin-to-skin contact, and that's very likely the way it happened. But this is under active investigation by the CDC, so I don't want to say anything definitive about that, but that's almost certainly how that happened.
Dr. Fauci, beyond monkeypox, we, of course, are still dealing with the coronavirus. In cases surging across the country, the new highly contagious variant has become dominant, and that appears to have been what President Biden got. White House doctors saying he's doing well. But we wanted to ask you to speak to this. You yourself had COVID not that long ago, were treated with Paxlovid, I believe, and suffered a sort of a rebound case. Some symptoms returned a short time later. That's the same medication that the president is on. How concerned are you that could happen to him, and how bad were your symptoms?
Well, you're correct. I was infected. I went on Paxlovid. I had a rebound after about 3 days. My symptoms were mild throughout the entire. I mean, I never stopped doing anything that I was doing. I did all of my work virtually. So I wasn't sick. I had a running nose. I had a little bit of sore throat. I had a fever for about a day or even less, and that responded very well to Tylenol. And then I didn't take any Tylenol. It was gone. So that's a situation. Rebounding is something that is still now under investigation, that when you look at the studies, it generally does not occur very often, though there have been anecdotal cases that look like it's occurring more than the original clinical trials show. With regard to the president will be tested frequently. Again, right now he feels very well. He's finished his 5 days, and we're going to now have him continue with his activities, and depending upon the test and how he does over the next couple of days, he's going to be out and about.
Well, Dr. Anthony Fauci, we are glad you are feeling well and certainly hope the president does too. Thanks again for being here today.